Hi everybody. Today we will learn what is preload and afterload. Before learning preload and afterload, you should know what is cardiac output because preload and afterload can affect the cardiac output. So what is cardiac output? It is the output of the heart or blood volume, the blood pumped by the heart in 1 minute. So normally the heart pumps around 4 to 8 liters of blood in a minute. So cardiac output is the volume of blood pumped by the heart per minute, and it is 4 to 8 liters per minute. You get cardiac output by multiplying stroke volume into heart rate. So remember the formula, cardiac output is CO is equal to stroke volume into heart rate. What is stroke volume? It is the volume of the blood pumped by the heart in one heartbeat. So that you multiply with heart rate, that is number of beats per minute, you get the cardiac output. So when stroke volume increases, cardiac output increases, and when stroke volume decreases, cardiac output decreases. So the cardiac output is affected by the stroke volume. Now let's see what are the factors that can affect the stroke volume. Stroke volume is affected by 3 factors: preload, contractility, and afterload. So the preload and afterload can affect stroke volume, which affects the cardiac output. Now let's see what is preload and what is afterload. What is preload? So remember, the heart receives deoxygenated blood from the systemic circulation into the right side of the heart, and the blood flows into the right ventricle. So to accommodate or to fill this blood, what happens is the ventricle expands or the ventricle stretch, because now the blood is coming to the right side of the heart. The ventricles expands to fill or to accommodate this blood. So preload, before loading, remember the word. So that is the ventricular stretch at the end of diastole. Why at the end of diastole? Because blood filling happens in the ventricle during diastole. So at the end of diastole, the ventricle expands to accommodate the blood coming from the systemic circulation. So that is, and preload is equal to the volume of blood received by the heart. The more volume the heart receives, the more stretch the ventricle has to do to accommodate the blood. So the preload is equal to the volume of blood received by the heart, and you define preload is the ventricular stretch at the end of diastole. So remember the key word, preload is the volume, is the stretch, or it is the volume. Now what is afterload? So the heart receives blood to the right ventricle, and right ventricle pumps blood into the pulmonary circulation. The blood gets oxygenated, and this oxygenated blood comes back to the left side of the heart into the left ventricle, and the left ventricle pumps blood into the systemic circulation. So the right ventricle pumps blood into the pulmonary circulation, and left ventricle pumps blood into the systemic circulation. So to pump blood from the ventricle, heart has to exert some pressure. That is afterload. That is, for loading or afterload is the pressure the ventricle has to exert or the heart has to pump to get blood out of the ventricle. So afterload is the pressure the ventricle exert to pump the blood. It is the pressure or the resistance the heart has to overcome to eject blood. So the key point is afterload is the pressure. So remember 2 key words so you can remember the idea of preload and afterload. Preload is the volume and afterload is the pressure. So when the heart receives blood, the ventricles stretch. So the preload is the ventricular stretch at the end of diastole, and it is equal to the volume. Whereas afterload is the pressure the ventricle has to exert to pump blood. So afterload is the pressure. Preload is the volume and afterload is the pressure. So the key word is preload is the volume and afterload is the pressure. Now let's see what are the factors that can affect preload and afterload. Preload. Now let's see what increases the preload. IV fluids. So you are giving more fluids to the patient. What happens when you give more fluids? The blood volume increases. There is more blood volume, more blood comes back to the right side of the heart. So more volume, the preload increases because preload is volume. Second is sympathetic nervous system stimulation. What happens in sympathetic nervous system stimulation? When there is stimulation, vasoconstriction happens. That is constriction of the blood vessels. When the blood vessel constrict, blood from the peripheries or blood from the organs comes back to the right side of the heart because the blood vessels are narrowed. So there is more volume coming. There is more venous return to the right side of the heart. More volume, again the preload increases. So what can decrease the preload? One is diuretics, example Lasix. When you give Lasix to the patient, it removes excess fluid from the blood. So the blood volume decreases. So when there's a volume reduction or when the blood volume decreases, there is less venous return to the heart, less blood volume to the heart. As a result, preload decreases. Vasodilators, example nitroglycerin. So what happens with vasodilators is it dilates the blood vessels. When it dilates, there's blood pooling. More blood goes into the organs or more blood to the peripheral circulation. As a result, there is less blood coming back to the heart because blood pools into the peripheries or into the organs. So the blood volume, the decreased venous return, that decreases the preload. Now the third is morphine. So along with the analgesic effect, it is an opioid analgesic. Along with the analgesic effect, it has a vasodilatory effect. So when there is a vasodilatory effect, we explained earlier, it's going to decrease the preload. Now let's see what is afterload. So afterload is the pressure. It can be aortic pressure because the left ventricle pumps blood into the aorta, or it can be the pulmonary pressure because the right ventricle pumps blood into the pulmonary, into the lungs. So it can be pulmonary pressure. So it is the pressure. What can increase the afterload? One is hypertension or pulmonary hypertension. So when there is more blood, when the blood pressure increases, what happens? The ventricle has to exert more pressure. There is more pressure in the blood vessel. So the ventricle has to exert more pressure to pump the blood into the vessel. Also the pulmonary hypertension. The right ventricle pumps blood into the pulmonary circulation. When there is pulmonary hypertension, there is high blood pressure in the pulmonary circulation, the right ventricle has to overcome, or the right ventricle has to exert more pressure than the pulmonary hypertension to pump the blood. So when there is hypertension or pulmonary hypertension, the afterload increases. Second is vasopressors. What does vasopressors do? Vasopressors constrict the blood vessels. It makes the vessels narrowed. So when there is narrowed blood vessel, there is more pressure. The size of the blood vessels decreases. There is more pressure in the vessels. Whenever there is more pressure in the blood vessels, the heart has to overcome, or the heart has to exert pressure higher than that. Then only the heart can pump the blood. So vasopressors can increase the afterload. Now the third is valve issues. Example aortic stenosis. So left ventricle pumps blood into the aorta, and the aortic valve is present at the opening of the aorta. So the aortic valve has to open to pump blood into the aorta. What happens if there is a valve issue? Like aorta cannot open, it's narrowed, it cannot open. So to open that valve, again the ventricle has to exert more pressure than normal, so that the valve gets open and it can push blood into the aorta. So whenever there is a valve issue, the ventricle has to exert more pressure. When there is more pressure, afterload increases. Now what decreases afterload? Medicines like ACE inhibitors. It has a vasodilatory effect. When it dilates the blood vessels, it decreases the pressure. When pressure decrease afterload, the ventricle has to exert less pressure to pump the blood. Vasodilators, again, it dilates the blood vessels, so the ventricle has to exert only less pressure to pump the blood. So now how can preload and afterload affects the cardiac output? So remember, the preload is the volume, it's the ventricular stretch at the end of diastole, and afterload is the pressure the ventricle has to exert to pump blood into the circulation. So preload is the volume, that's the key point, and afterload is the pressure. So preload increases, that is volume increases. So when preload increases, stroke volume increases. When stroke volume increases, it increases the cardiac output. Afterload has a negative effect on the stroke volume, that is the pressure. So when the pressure increases, heart cannot pump blood because there is more pressure. Our heart has to exert more pressure to get blood out of the ventricle. So when the afterload increases, stroke volume decreases. When stroke volume decreases, cardiac output decreases. If the afterload decreases, less pressure, there is more stroke volume. Stroke volume increases and it can increase the cardiac output. So today we learned about preload and afterload, and thanks for watching my video.